Thank you. And I would like to thank you for such a great conference, and thank you for introducing me. So today I shall present a poster of a cross-sectional study of the clinical predictors for a positive pan-CT findings in children with polytrauma. So to start with, pan-computed tomography, in short, which is pan-CT, is also known as a whole body CT, or as well known as a total body CT. It's a powerful, accurate, and effective diagnostic tool. It refers to the radiological evaluation of the head, neck, chest, abdomen, pelvis, and spine. So Pandit et al. Have illustrated that while assessing pediatric trauma patients, physicians often rely on CT imaging as they are widely available, fast, and accurate. In 2017, Food and Drug Administration has highlighted that a CT scan increases the possibility of developing cancer, as reported by some of the studies. One of these studies that they refer to suggested that there is one fatal malignancy case for every 1,000 CT imaging of young children. So the lifetime risk of developing cancer from medical imaging radiation depends on several factors. First is that pediatric organs are about 10 times radiosensitive compared to adult organs. In 2017, Food and Drug Administration has highlighted that the CT scan increases the possibility of developing cancer, and that was reported by some of the epidemiological studies. One of these studies that they referred to suggested that there is one fatal malignancy for every 1,000 CT imaging of young children. And we said that the lifetime risk of developing cancers in pediatrics increases, and that depends on many factors. First, that pediatric tissues are about 10 times radiosensitive compared to adult tissue. Second, relatively pediatrics have a longer life expectancy than adults, and that would result in a larger window to express the radiation damage. Third, there is the possibility of receiving extra radiations if the CT dose was not adjusted to the child body size. Last, children might have multiple CT scans during their lives. So researchers studying the CT utilization trends showed significant variability. Ludwig et al. Found that CT trends in the period from 2009 till 2013 in 30 tertiary pediatric hospitals revealed an overall decrease in CT requests. And that's in contrast to Larson et al., who has outlined a 5-fold increase in pediatric CT scans requested from emergency department in the period from 1995 till 2008. So in Oman, a preceding study was conducted, and it reported that there was upsurge in CT scan trends. It reported that there was a 56% increase in CT requests from 2010 until 2014. After all, it's a single center study, which may not reflect the pattern of CT utilization in the country or the Gulf region. So, referring to a number of studies that have highlighted there are more than 30% of unnecessary pediatric CT scans or CT scans that could be replaced by non-ionizing radiation imaging procedures. So our study aimed to study the association between pan-CT scan reports and the clinical predictors. And we've selected some of these predictors, the demographic characteristics, including age and gender, triage category, vital signs, including blood pressure, heart rate, and respiratory rate, Glasgow Coma Scale, and mechanism of injury. Our study explored the trends of pan-CT utilization in pediatrics with polytrauma at Sultan Qaboos University Hospital. So moving to our methodology, it's a single center, retrospective, cross-sectional study, which was conducted at the emergency department at Sultan Qaboos University Hospital from 1st of January 2010 till 31st of December 2017. So in our study, all pediatric patients younger than 13 years old who had a pan-CT following a polytrauma were enrolled. The clinical predictors were abstracted, as I've mentioned previously, and then chi-square was used to look for any association among these study variables and the positive pan-CT reports. So in our study, our inclusion criteria was all children aged less than 13 years who were admitted to the emergency department and who had available pan-CT reports after a polytrauma. Participants were excluded if the child had a pan-CT for any reason rather than blunt trauma. And as well, participants were excluded if the data were missing. In this study, a positive pan-CT was defined as all trauma-related findings on pan-CT. In other words, incidental findings were considered as negative scans. For triaging the patients, we use the Canadian triage system, which is applied at Sultan Qaboos University, which categorizes patients into 5 categories: resuscitation, emergency, urgent, less urgent, and non-urgent. And based on Glasgow Coma Scale, patients were categorized into 3 categories: mild brain injuries, with the Glasgow Coma Scale of 14 or 15. And patients who had a Glasgow Coma Scale of 13 up to 9, they were considered to have moderate brain injury. Patients who had a score of 8 and below were considered as a severe brain injury. Now we categorize the mechanism of injury into 3 categories: The first, motor vehicle collision. The second, fall from heights. And the third were included others. For example, if a heavy object fell on the patients, they will be included under others. It was found that motor vehicle collisions were the most common cause of polytrauma in pediatrics during this study duration. We also subcategorized MVC, which is the motor vehicle collision patients, into two categories, pedestrian and non-pedestrian, because we found pedestrian patients presented with the more severe injuries compared to the non-pedestrian. The other variables, which they are the vital signs, were classified as normal and abnormal. So, moving to the results of this study. Our sample size was 242 children, of whom 36% were females. And the trends, as shown in the figure, showed a threefold increase in pan-CT trends between 2011 and 2012. And that was followed by a plateau from 2013 to 2017, as you can see. This increase can be explained by a number of reasons. First, there were changes in emergency imaging protocols during that period. Second, because of the evolution of hospitals' radiological facilities. Third, the increasing trends of accidents, especially MVCs. Fourth, and the last reason, it's because of the increase in population numbers, especially pediatrics in Oman. As you can see, the figure also shows that there is an increase in the percentage of negative scans, which is shown in blue color. It was found that almost 2/3 of the total pan-CT scans had a positive findings. And only 34% of patients who had a negative pan-CT report were discharged home. And that concludes it's irrational to consider these negative scans as a misuse of radiological imaging. The table shown there summarizes the chi-square test of the clinical predictors, which they are gender, age, triage category, mechanism of injury, Glasgow Coma Scale, and vital signs in relation to the positive and negative pan-CT. So as you can see, the 43 patients were categorized in resuscitation as a triage category. And out of these, 74.4% had a positive CT report. On the other hand, 149 patients were triaged as emergency cases. And 69% of those had a positive pan-CT. On the other hand, There was one patient who was classified as less urgent, but he had a positive CT report. And two patients were classified as non-urgent, and both of them had a positive PAN-CT. You can see there is no significant association between the triage category and the positive CT report. Moving to Glasgow Coma Scale, where 42 patients presented with severe traumatic brain injury. And out of those, 71.4% had a positive CT report. In contrast to 28.6% who had a negative CT report. If we see that mild traumatic brain injury patients were a total of 166 patients, and out of these, 119, representing 71.7%, had a positive PAN-CT. It highlights the fact that we cannot study and we cannot find any association between the severity of traumatic brain injury and the possibility of positive CT report. Moving to mechanisms of injury. 70.1% of a total of 147 patients who had motor vehicle collisions has a positive CT report. And same percentage of patients who had falls had a positive CT reports, with a total number of 47 patients. So all in all, these predictors were not related to PAN-CT findings. Similarly, patients presented with abnormal blood pressure, abnormal heart rate, and abnormal respiratory rate were not associated with a positive PAN-CT reports. So to conclude, other studies are needed to confirm and extend these findings. We would like to suggest a prospective multi-center study that includes a larger sample size. Thank you for your attention, and I'm happy to answer your questions.